Hi, social media. I'm back with a health update and some answers to some of your questions that you all posted. So, I'm fine as far as health goes. I got a little bit of good news from my doctor. It's not as bad as was thinking. So, thank God for that. So, there is still need for me to continue my, medication therapies and things like that. I'm not out of the woods yet, but I'm better than I could have been. So, praise the Lord. Okay, now let's get to the answered questions. Um, One of my questions was as far as the terms that I used on my previous videos, like biopsy. Well, that's the first invasive procedure I had to discover what was going on with my breast. So, the biopsy is when the doctor takes a needle. It can be a fine needle or a larger needle, which is called a core needle. Now, I've had both because I've had two biopsies done. The first biopsy was the fine needle aspiration biopsy, which, they used a small needle to take a small blood sample to look under the microscope and see, what's what. Now, they wasn't able to determine much, so they went on and they did a second biopsy using a core needle, which is a larger needle that they use to extract not only blood but some tissue from the breast, from my left, affected breast. So they took the tissue back and they looked under the microscope and everything and tested it with certain things, and that's when they discovered that I had stage 2 breast cancer. And my oncologist, my surgical oncologist, because I have a few of them, but my surgical oncologist, the one that cuts me, all the time, he suggested a lumpectomy, because he's trying to save the breast and, have me looking more normal as I can. No sense of cutting was not necessary. So I agree, and he performed the lumpectomy. That's another term, lumpectomy. And it's not too difficult to understand. That's just when they just take out just the lump itself. So I went on ahead and I got the lumpectomy. And this is where you see this scar going up and down, because this is where they actually did the incision for the lumpectomy when they removed the lump. Okay, fast forward. After the lumpectomy, the doctor also noticed that he didn't get all of the abnormal tissue. We had positive margins and borders of the lump that he took out of my breast. So he then suggested not a lumpectomy, a mastectomy. That's a full mastectomy. Now, there are also different types of mastectomy. The mastectomy I had, unfortunately, I had to get a radical mastectomy. That's where the doctor took away the whole entire breast, including the breast tissue, the nipple, everything. He took away some muscle, chest wall area, and he went under my arm and he took a few lymph nodes. So that was my mastectomy. Now, it was also a second procedure during my mastectomy called a lymph nodectomy. I know these terms are just something else, but the lymph nodectomy is simply when he went under my arm and he took some lymph nodes. So he took about 3 of them, and the good news on that was only one came back positive for abnormal cells. So it didn't reach, many lymph nodes. So he feels the cancer hasn't really spread to other parts of my body, So that was a plus. Okay, the next question, someone was asking, why was my urine blue? Okay, so during one of my surgical procedures, actually my lumpectomy, The doctor injected some blue dye into my actual tumor. When the tumor, right before he took the tumor out, he injected the dye into the actual tumor. And he waited a while and tested me like every 30 minutes for a few hours to see how the dye is filtering through my system, and see if the cancer had possibly spread, to other areas and things like that. So that's what the dye was for. And with the dye, he was able to cut around clear margins and, take out the cancer. Well, most of it. So, my urine was blue because the dye was injected in my body, and normally the body filters things that goes through, so my it filtered through my kidneys and liver and all that stuff, and it excreted itself out through my urine. So that's what happened there. That's why I peed blue for about 3.5 days. After that it got lighter and lighter until eventually it went back to my normal urine color. So also, I had more than just that incision. You probably see this little bump here. This is my port. This is for the chemotherapy. They put this in when they did the mastectomy, when they removed my breast on this side. They put this small instrument underneath my skin. It's just under my skin. It's not like deep in there or anything. And so they put this here for the efficient delivery of my chemotherapy that I'll be receiving soon. So that's what that is. And some people were asking about my drain. Okay, the last video, I was hooked up. I had like some kind of string, some type of drain hooked up to me, and it's removed now. The doctor, took it away. So that drain I had, that was actually because of my lymph nodectomy. Now the lymph nodes, it serve a purpose of getting rid of certain waste like sweat and things that naturally, expel itself from your body. So since the doctor took those, I had to have a drain to release any fluid or sweat glands, any thing that naturally is supposed to expel itself from my body. That's what the drain did. So that was the purpose for that. And after little by little, the body heals itself. So the drain served the purpose to get rid of the waste material. But little by little, my lymph nodes was healing themselves. Well, my lymph nodes are gone, but the area that the fluid come from, it started healing itself, and I started getting less and less fluid in my drain and bulb. And once it got down to like such a small amount that I was outputting every day, the doctor just go ahead and say, let's just take this on out. So he removed that painfully nagging thing, that drain. It was nagging and painful, because like when I move certain ways, it'll just be pulling at me, and it's just, I'm so glad that's gone. Okay, so that was the drain is gone, and I'm glad. Yay. All right, so oh yeah, and some people were asking, because they're not familiar with this whole cancer things, about everything that they go through, why you gotta go to the doctor so much. Well, this is why. I have to go for this, the cut, the biopsy, the lumpectomies, the mastectomy, the follow-up visits, it's just so much to keep following up for. So and some people was wondering, like, okay, so what is chemotherapy? Well, chemotherapy is they're the drugs that the doctors use to kill the cancer cells. And that's what I'll be prepping for, soon. So that's the drug where most cancer patients, you see all their hair fall out, they probably lose weight, because they have nausea and don't want to eat, and or they have stomach problems and can't eat, or for whatever reason. So and they're constantly tired. That's part of the effects of the chemotherapy. So I hope it doesn't affect me, the way it affects most people. You know, there's always hope. So, and the last thing people were asking about pain. Okay, so immediately after the surgery, uh, I didn't have any pain at all because I was still under the local anesthetic. But the day after, boy, that was some pain. Yeah, I was in pain. I was. And I continued to be in pain, and I am still currently in pain, but it's not as bad as it was. So little by little, the pain is dying down. You know, it's going away little by little. You know, but the pain is still there. It's there, but it's not as bad as it was. Yeah. So, oh, you all probably want to see what it looks like now. Okay. Alrighty, let me show you. Okay, so I have my little cushion in here so it can, you know, try to look a little even. And you probably see my clothes. I have on workout clothes because I have to exercise. Part of my physical therapy, I have to work out 3 times a day. You know, just simple workout, doing arm rotations and movements and things to make sure I remain functionability in my arm. Because of the lymphnodectomy, it's possible that my arm can swell and, you know, the fluid can collect in there, and that wouldn't be a good thing. So they have me, you know, doing exercises and things like that to keep, you know, my fluids running in the correct direction, you know, so it can filter out correctly. And the exercises also helps give me mobility, because a lot of people that had surgery, they're in so much pain they don't even want to move their arm in that area. So they sometimes get stiff and you know, and starts leaning, and their posture gets bad. So that's why the physical therapy is helping, you know, so I can move around more. Okay, so here is the actual post-surgical whatever. Okay, I'm just gonna take off my shirt here. Okay, you see I'm kind of slipping out there. Well, I'm gonna go ahead and take off this shirt. I'm gonna leave the bra on because I still have, you know, one of them left. This is my, you know, real one, and this is the one where my cushion. This is my little cushion. I forget what it's called. I call it a cushion because that's what it looks and feels like. So it's just a little, you know, pad, little poof to help, you know, make it look like it's something there. This little hole, this is where that drain was. This is where my mastectomy, of course. And this is the lumpectomy scar. That's my port. Yeah, so that's what it's looking like now. It's trying to heal. It's not healing very beautifully, but hey, it's healing. So let me go ahead and put my cushion back in there. And try to make it, you know, balance it to look somewhat the same. Put my shirt back on. It's almost time for me to eat and work out again. Yeah. And now I'll go ahead and upload some more pictures, you know, just so you can get a good idea of everything. So yeah, that's what it is. So until next time, peace out.